So after a clot's formed, spinous pseudopods of the platelets adhere to strands of fibrin and contract. So this pulls on the fibrin threads and draws the edges of the broken vessels together like drawstrings closing a purse. And through this process of clot retraction, the clot becomes more compact, and all this takes about 30 minutes. Overall efficiency in coagulation, it can be measured with bleeding time after 1 millimeter deep incision. Bleeding time is most precisely measured by the IV method, inflating a blood pressure cuff on the arm to 40 millimeters of mercury, making a 1 millimeter deep incision in the forearm, and measuring the time for it to stop bleeding. That's what that means. So once a clot has formed, a process of local tissue repair begins. Platelets and endothelial cells secrete a mitotic stimulant named platelet derived growth factor, or PDGF. This stimulates fibroblasts, smooth muscle cells, to multiply and repair the damaged blood vessels. Fibroblasts, they also made the clot and produce fibrous connective tissue, which helps strengthen, seal the vessel while the repairs take place. Eventually, the tissue repair is completed and the clot must be disposed of. Fibrinolysis is the dissolution of a clot, and this is achieved by a small cascade of reactions with a positive feedback component. Factor 12 catalyzes formation of enzyme kallikrein, which in turn converts the inactive protein plasminogen into plasmin, which is a fibrin dissolving enzyme that breaks up the clot. Thrombin also activates plasmin, and then plasmin indirectly promotes the formation of more kallikrein, thus completing that positive feedback loop. And there's a picture, a little figure of that mechanism. Precise controls are required to prevent coagulation when it's not needed. So these include platelet repulsion, dilution, anticoagulants. The platelets, as noted earlier, they don't adhere to the smooth endothelium of healthy blood vessels. Dilution. So small amounts of thrombin form spontaneously in the plasma, but at normal blood rates of blood flow, the thrombin is diluted so quickly that a clot has little chance to form. So if flow decreases, enough thrombin can accumulate to cause clotting, but this can happen in circulatory shock when output from the heart's diminished and circulation slows down. Widespread clotting throughout the circulatory system may occur. Anticoagulants. Thrombin formation suppressed by anticoagulants in the plasma. Antithrombin, secreted by the liver, deactivates thrombin from before it can act on fibrinogen, and then heparin, secreted by basophils and mast cells, interferes with the formation of prothrombin activators, which blocks the action of thrombin of fibrinogen and promotes the action of antithrombin. Heparin is given by injection to patients with abnormal clotting tendencies. So, in a process as complex as coagulation, it's not surprising that things can go wrong. Clotting deficiencies, they can result from causes as diverse as malnutrition, leukemia, gallstones. A deficiency of any clotting factor can shut down the coagulation cascade. This happens in hemophilia. So this is a family of hereditary diseases characterized by deficiencies of one factor or another. Because of the sex-linked recessive mechanism of hereditary hemophilia occurs predominantly in males. They can inherit it only from their mothers. However, as happened in several members of the European royalty descended from Queen Victoria, the lack of factor 8 causes classic hemophilia, hemophilia A, which accounts for about 83% of cases worldwide. Whereas hemophilia B accounts for about 15% of those cases. We also have unwanted clotting. So thrombosis is the abnormal clotting of blood in an unbroken blood vessel, and that becomes increasingly problematic in older age. About 25% of people over age 50 experience venous blockage by thrombosis, especially people who don't exercise regularly or who are confined to a bed or wheelchair. The blood clots especially easily in the veins where blood flow is the slowest. A thrombus, aka clot, may grow enlarged enough to obstruct a small vessel, or a piece of it may break loose and begin to travel in the bloodstream as an embolus. An embolus can lodge in a small artery and block blood flow from that point on. If that vessel supplies vital tissue of the heart, brain, lung, or kidney, infarction, aka tissue death, can result. In the United States, about 650,000 people die annually of thromboembolism, so traveling blood clots in the cerebral, coronary, and pulmonary arteries. Most strokes and heart attacks are due to thrombosis, and pulmonary failure often results from a thromboembolism. So the goal is to prevent formation of clots or dissolve existing clots. Different items that are... Sorry, we are on the last slide and my dogs have decided to play. The goal is to prevent the formation of clots, right? These are different things that doctors use to do this. Dissolving clots that have already formed. Streptokinase is an enzyme made by strep bacteria used to dissolve clots in coronary vessels. TPA converts plasminogen into clot-dissolving plasmin, and then Hemagtin is an anticoagulant that originates from a leech found in the Amazon, which back in the day, leeches were used very commonly for any sort of blood. I apologize. My two huskies have been patient enough. But that concludes chapter 18. Please let me know if you have any questions.